Hello and welcome back to another MedRevisions video. Today we'll be discussing a February 2022 recall and also give you some helpful tips for the upcoming PLAB 1 exams. Okay, let's dive right into the video. Now before we discuss the question, please take 50 seconds to pause the video and comment the answer down below. Okay, now let's get to the question. So we have a 30-year-old pregnant woman of 23-week gestation who presents to the GP surgery with pruritus. She also complains of occasional right upper quadrant pain and her BMI is 30. The patient has no other medical history of significance and her recent antenatal examinations were normal. What is the single most appropriate initial investigation? Okay, so the correct answer here is liver function test. Okay, answer A, liver function test. Now we'll see why in a bit. And before we discuss the correct answer and other options, please don't forget to like and subscribe to our YouTube channel. And also there's a link below for the reviews that our PLAB 1 candidates already gave us. So check that out as well. And also comment down below on any other topics that you'd like us to cover in the future. Alright? Okay. Alright, so let's see why liver function test is the answer. So the examiners are pointing you towards a direction of gallstones. That's because pregnancy alters the composition of bile. Therefore, gallstones are common in pregnant women. Alright, now pruritus or itching and abdominal pain are one of the common manifestations of gallstone. Alright, and remember also that there are 5 F's when it comes to gallstones. That is a mnemonic that you can remember easily, the 5 F's of gallstones. So female, fat, 40, fertile and fair. So she has 3 of the F's out of the 5. She has a high BMI, which makes her fat and female, and she's also fertile, meaning she's pregnant, so it fits into the picture. So therefore, the next best step here would be performing the liver function test to see if there is any abnormality. Then the next step forward would be to perform an ultrasound scan. Okay, so they're asking for the most initial step. Therefore, liver function test would be the best choice here. Why not thyroid function tests? Now, thyroid function tests are not necessary here as she does not have any signs of hyperthyroidism or hypothyroidism. Full blood count is also unnecessary here because there's no signs of infection or anemia. That would not help us in this matter. Okay, CT scan is always the wrong answer for an initial investigation, and therefore this is wrong. Okay, ultrasound scan. Ultrasound scan of the abdomen can be done after LFTs to rule out gallstones or any other abnormality. Alright. So that concludes our question discussion. I hope that was helpful for all of you. Check out our MedRevisions platform for more questions like these with high yield topics as well as some of the rare questions that you might come across in the exam. Thanks for watching. This video was brought to you by MedRevisions, your go-to resource for PLAB Part 1. Complete your revision with MedRevisions.